Prostate cancer is the most common cancer for men, and Prostate Cancer Institute of Arizona is one of the few places that can perform LDR prostate brachytherapy. And Dr. B, the founder of the institute, is here to tell us a little bit more about the treatment. And did I say right, LDR brachytherapy? And what is that?
Well, first of all, great job on pronouncing that term. But I got a little shortcut for you.
Okay.
Low dose rate prostate brachytherapy is also commonly called prostate seed implant. So we can just say that for now.
Prostate seed implant.
Yeah.
There it is.
And basically, this is a procedure, an operative procedure done in the operating room under general anesthesia, where I permanently implant radioactive seeds in the prostate to eradicate the prostate cancer.
Got it. And people have to realize this is one form of prostate cancer, because there's different forms, of course. This is the mild form of prostate cancer that you can take care of, right?
It's for men. This treatment is basically for the majority of people that have prostate cancer localized to the prostate, where the prostate cancer is contained.
Got it.
And with screening mechanisms now, it's becoming a lot more common for men to be found in the earlier stages.
So, and that's what's so important with that going on. So let's talk a little about how this procedure works, because it's almost like a day procedure, really. Is that what I've been told?
Yeah. So the procedure takes not even an hour. You actually go home the same day. There's actually very minimal downtime, and actually has the highest erectile function preservation rates. Last week, I had a patient go to work the day after the procedure.
Yeah, and that's one thing that people have to understand about this, is that with the new technology that you're doing, because we said this was something that was done before, but now there's new technology that you are studying, and you're pretty much one of the few in Arizona that actually perform this, correct?
Yes, that's exactly correct. This is a procedure that does require a relatively amount of experience and skill, and like as you said, has been done historically, but now there are some new advancements to make it even more better. For instance, what I do now is I plan the radiation plan right at the time of the procedure. Historically, we would use the images of the prostate prior to the procedure to create our radiation plan, but I actually do what we call a real-time plan, and that allows for maximal precision and accuracy, because the prostate can change. And so making the plan right there and then allows for an optimal plan. Yeah. Another advancement is the use of rectal spacers. This is where we create a space or a barrier between the rectum and prostate to spare the rectum from radiation damage. This can be placed at the time of the procedure or before. And this is another big game changer, because rectal damage, such as rectal bleeding, used to be somewhat of a common problem for men who underwent radiation for prostate cancer.
Yeah. I love that we're talking about this, doctor. I know sometimes this has been a forbidden thing to talk about because of the procedure, what goes on, but more and more men, as we see, are getting prostate cancer different ways from, their diets, whatever like that, and that's why this is important to talk about. But I think the other thing that worries men and not really want to talk about, and that is their bedroom performance with this, and that kind of scares them when they start talking about the prostate. Am I right?
Yes. Many treatments for prostate cancer can result in impotence or erectile dysfunction. Fortunately, this treatment actually has the highest erectile function preservation rates, and men should feel comfortable being able to perform even after this treatment.
Yeah. One thing you talked about in that is, of course, prevention. That's always talking with your doctors and sitting with them, but also just come and sit with you. You like to sit and talk to them and to take them through what's going to be going on, what's happening, and that's important too. The talk with the doctors. Am I right?
For sure. I mean, having awareness, being conscientious and proactive about your health is the way to go.
Yeah, and I like too, doctor, that you knew that this kind of procedure was kind of like not going away, but just started not being used as much, and that's why you say, what, this is a great way, the new technology, and that's why at PCIA, it's so important that you guys continue this kind of procedure. Am I right?
Totally. I mean, this is the mission of this practice, is to revive this modality that went away for the wrong reasons.
Yeah. Well, I love it. I love that you're also part of our Live Well campaign. You're also, a big part of the station of making sure that men are being healthy in different ways, and educating us on, of course, the Prostate Cancer Institute of Arizona. And say it for me again, the type of therapy is called?
Low dose rate brachytherapy,
or
prostate seed implant.
there you go. Doctor, thank you very much. So, hey, we have information on aztv.com for more information about the Prostate Cancer Institute of Arizona and, of course, our Live Well programs that we have out there. So,